Hey, welcome everyone. Aloha. Welcome to the Hawaii Pacific Gerontological Society's October webinar, Navigating Medicare for 2020. My name is Mapuana Ta'amu. I'm one of the board members for HPGS as well as the chairperson for these webinars. I wanted to draw your attention to the chat box before we begin. If you do have any questions, please feel free to add your comments, your questions to the chat box. I see somebody has already used the chat box. Thank you very much. But anything you want to contribute, or if you have questions, please do stop Travis in the middle of his presentation to ask your questions using the chat box. If you aren't a member already, we do have various rates for members, whether you're an individual, a kupuna, or a company. So that's up here at the top right corner. Along with our membership, we do have a bunch of benefits. So we have monthly electronic newsletters that we send out to our members. It has a lot of age-related news, events, activities, not just on Oahu, but on outer islands as well. We also do monthly webinars just like this one, presented by professionals, and our members are welcome to host or provide presentations for our webinars. We have quarterly membership meetings. We just had one last week that talked about Medicare and estate planning. Next year, we'll start again in January with our first general membership meeting of the year. HPGS is also proud to offer scholarships for people of any age, really, pursuing education in the field of aging. So even if you are going to get your certified nurse aide certification, we do offer a scholarship for that as well. And we have a website that provides a lot of resources. These webinars will also be posted to the website. I'll show you that in a little bit. But please do visit our website at hpgs.org. And to become a member, this is our website here. You're going to want to click on that membership tab there at the top navigation bar, and it will redirect you to our membership page. So at the bottom, you see our membership form. You can click that for next year and sign up to become a member to receive all these benefits that we're offering. I think you also can pay online, or if you're not an online payer type of person, we do have a PDF that you can print out and send in via snail mail or regular mail postal. And then if you want to check out our webinars for this month, we will record it and it will be posted to our webinars tab there at the top. Otherwise, we have been posting webinars since January of 2019. So from January all the way till now, we will also have webinars for November and December, and then we want to continue for next year as well. So if you're watching and you're already a member, you have something that you want to present on, please reach out to me at the end of this webinar. I'd love to schedule you for a webinar next year as well. So this is where you can find all of our past webinars. And now let's get down to business. So I've invited a special guest today to talk about Medicare, navigating Medicare for 2020. And he'll also give us an introduction to Medicare.gov Sites so that those of you at home who are enrolling in Medicare can find this information for yourself. It's also personalized, so you put in your information and then it comes up with some benefits that you could also check out online before seeing an agent. But there are, So our webinar speaker today is Travis Motosue. Travis is the president of Financial Benefits Insurance, an independent full-service insurance agency whose sole duty is to their clients' best interest. Travis is a local boy who grew up on the windward side of Oahu, and from a young age, he was heavily involved in many community service opportunities. He attended and graduated from Iolani High School in 1999, and following his graduation, he went on to attend Oregon State University and then graduated from the University of Hawaii with a BS major in biology in 2003. Travis Motosue has been working with insurance and has specialized in Medicare options for seniors since 2004. Travis has 15 years of experience in the insurance business, helping the needs of Medicare options for Medicare eligible beneficiaries. Travis, thank you for being here today.
Thank you, Mapuana. Thank you for allowing me to speak to you guys about Medicare. So today we're going to talk about the Navigating Medicare 2020 Introduction to Medicare.gov. So this is pretty much, so this is myself, this is my father. I also had my grandparents in here as well. So basically, I got involved with the Medicare business. Basically, when I went to Iolani, I was staying with my grandparents, and I was staying with my grandparents. My grandma used to make lunch for me, take me to school, take me up from school, take me back home. And after that, basically, when I went to college, the reason why I transferred back to UH was basically I wanted to help take care of my grandparents. My roles were reversed, so I needed to take them to the doctor's appointments, take them to the grocery store, and things like that. That's how I got involved with insurance, because after I graduated from UH, my uncle, my cousin wanted me to help out other people's grandparents as well. So that's how I got involved with the insurance business, helping out my grandparents, pictured over here, and want to help out other people's grandparents as well. And this is also my children as well, which is, keeps me going, keeps me very busy. This is our office that we're located. So if you guys have any questions, you want to come and see us, we can be able to help you with your concerns over here at 1311 Kapiolani Boulevard. Our webpage is also fbihi.com. So if you wanted to come and check out our website, we're over here as well. Or you can even call us at our office at 792-5194. So today we're gonna talk about the Medicare and You. Okay, so basically Medicare.gov. You guys already probably seen this book, the 2020 Medicare and You book. You probably have gotten that in the beginning of maybe the second week of October is when these books have went out. So you guys probably have gotten this book. And so if you guys got this book, a lot of times you guys don't read it. So you guys just replace it with the 2019 book, and you guys just replace the old one with the new. But no worries, that's why we're over here to help you out with your questions and concerns. So if you have any questions, be free to put them in the chat box so I can be able to answer any questions that you may have arise. I just want to make sure about the new Medicare cards. You guys already got the new Medicare cards already, so which is a good thing because that protects your identity. Just make sure that the old cards, you destroy your old cards, you shred it, because your old card has your social security number on it. So just make sure you destroy your old card and keep the new card. The new card does have a bunch of random numbers which protects your identity. So just make sure you use your new card and destroy your old card. Okay. If you wanted to replace your new card, if you misplaced it, you lost it, you can always go on mymedicare.gov and be able to print out a new one if you sign up over there. Or you can also call Medicare, the phone number for Medicare as well, and that one will be able to help assist you with your questions. Okay, so now I want to go over, when you're looking at different plans, yeah, you got to also know what plan is right to choose. When you're looking at a lot of different plans, basically the main things you want to look at is 4 different things you want to look at. So the first thing you want to look at is network. So choosing any kind of plan you're looking at, you want to make sure the network of the plan you have is in your providers, your hospitals, as well as any kind of clinics you go to is in the network. Okay, so just make sure whatever plan you want to go with, make sure they're in the participating with the network. Or if you're in the PPO plan, that's fine. Just know that you're gonna pay. You can go out of the network, but you'll pay a little bit more. Okay. Another thing is looking at formulary. So just make sure that all your medications you're taking is in the formulary. Okay. So there's many different plans out there, and every year the formularies change. Every year your prescriptions could change. So just make sure you're checking them out, because sometimes I've seen it where one year it's a tier 1 medication, the next year it could be a tier 3 medication or tier 4. And every different company has different tiers. So just make sure you look at the different tiers and different formularies of your medications, because that could make a difference in terms of what plan you're going with. But everyone's formularies is different. So every year you want to check it out, because one year it could be on, the next year it could be off. Okay, so just make sure you're looking at the formularies every year, and your medications could also change from year to year. Another thing you want to look at is portability. So portability is a very important to look at. Is if how often do you travel? So sometimes people travel to the mainland or travel to different places. So just make sure your plan is portable depending on where you go. Sometimes you want to go out of state. You may have a second home, or you might want to visit some children or grandchildren. So just make sure your plan is portable if you are traveling out of state, or even sometimes could cover out of country. Okay. Now cost. You want to also make sure cost is also important. What plan is in your budget? So you want to make sure the plan that you have is within your budget. Some people are willing to pay a higher premium for low co-payments, or you want to be the 0 premium plans or low premium plans, and you would have higher co-payments or co-insurances. So let's make sure there's many different plans out there. So right now is the time that you can be able to look at different plans. So just make sure you can be able to compare the plans and make sure everything stays within your budget. There's many different plans out there, so just make sure you do your research into the various plans out there. Okay, so there's also important dates to remember. Okay, so right now, so there's many different important dates to remember. So we passed the October 1st, but October 1st is a time you can be able to finally compare plans in the area. So you can be able to look at all the different plans on October 1st. 2019, next year is going to be October 1st of 2020. So just make sure October 1st is the time you can be able to look at plans and compare different plans in the area. Okay, but October 15th till December the 7th, that's actually the time then you can be able to change your plan. So even though you can look at your plans from October 1st to October 14th, October 15th to December the 7th, which is actually right now, we can be able to look at different plans right now and compare plans. And if whatever you want to decide to choose, if you change plans, you can change plans and you'll be effective come January 1st. Okay. If you choose not to do anything, you love your current plan that you're currently in for this year, you don't do anything, you're just going to be automatically rolled over into the plan that you have for this year. Okay, effective for January 1st. Okay, so during this time, you're probably bombarded by a lot of mails. I see a lot of commercials out there about join this plan, join that plan. So around the time, you can be able to look at different plans, make sure you have a plan that's good for yourself, at least for the following year for 2020. Okay. Now they also have this other period called an open enrollment period from January 1st to March 31st. So January 1st to March 31st, they bring in this thing called open enrollment period. So that they brought it back in 2019. Okay, this year 2019 as well as 2020. They also have it for 2020. It's an annual open enrollment period, so also known as OEP. So during this time, open enrollment period, it's the time that if you want to, you can try out the plan. Say if you made a change from October 15th to December the 7th, you started the plan in January 1st, you can try it out. And if you maybe you're trying out the plan and it wasn't really what you thought it was, or maybe you didn't make a change, you didn't make a change, and come to find out that one of the benefits that you loved, now the benefits cost a lot more on that plan, and maybe you want to make another change. So during January 1st to March 31st, that's another time you can try out the plan, or you can use the plan. If you didn't like that plan, the Medicare Advantage plan, you can always change Medicare Advantage plan from January 1st to March 31st. Or another thing is, maybe you're coming from a Medicare Supplement plan, or you just want to go back to original Medicare. You can go back to original Medicare, sign up with a standalone Part D prescription drug plan. And if you wanted to go with a supplemental plan, or just stay on original Medicare. Okay, so just want to let you know those are important dates that you guys can know about of these times. There's also other times you're not just locked in during these time frames. There's also a thing called a special enrollment period. So the special enrollment period, if you do look into that, maybe there's different times that you can be able to also make changes. So like maybe right now, if you're on Maui, there's also a special enrollment period for those on Maui because they have the fires going on. So FEMA actually has some fires on Maui. So if you wanted to make a change right now and you live on Maui, you can be able to make a change if you wanted to, because it's a natural disaster per se on Maui. Okay. Also, some things where I have some clients, maybe they're moving from Oahu, from Maui, from Kauai. A lot of them I see are moving to the Big Island, Keau area. It's a lot more affordable over there. And if they make a change, you're moving counties, that's another time you can make a change. Or maybe you're retiring from your job, or losing Medicaid, or getting Medicaid, or getting low-income subsidy. That's another time you can make another change. Okay, so there's many different changes at times that you can make a change. Okay, not just during those times. Okay, come and see me if you have any questions on that. Okay, so another thing that's important to look at is a quick look at Medicare. And so quick look at Medicare basically is the important things about quick look at Medicare is the fact that on quick look at Medicare, you can go over the parts A, B, C's, and D's about Medicare. So for that one, basically for the ABCs about Medicare, quick look at Medicare, but we already had some people already talk about the ABCs and D's, so I'm not going to go over that. I'm just going to go over the other things about Medicare.gov, how to find some plans. Okay. But basically, the quick look at Medicare, basically the important things I want to talk about is that there's different options about it. So if you look at Medicare.gov, they have many different plans you can compare, but I wanted to make sure you're aware about original Medicare. Basically, you have two different options when you're going on Medicare. Basically, you can go with original Medicare, the option on the left, original Medicare. Original Medicare roughly covers around 80% you're roughly responsible for roughly a 20% co-insurance under original Medicare. And then because original Medicare does not have a Part D drug plan or does not cover any prescription drugs, that's when you pick up the standalone Part D prescription drug plan if you go on the option on the left. And if you're worried about that 20% co-insurance, then that's why some people pick up a Medicare supplement insurance, also known as the Medigap insurance. So that's the option on the left, or option 1. There's also an option on the right, option 2, which is also a Medicare Advantage plans, also known as Part C plans, usually HMO or PPO plans. And then usually it comes with a Part D prescription drug plan built inside. And usually these Medicare Advantage plans also has additional benefits built inside there as well. Okay, which is the reason why a lot of people do go with Medicare Advantage plans, but everyone is different. Some people still like supplemental plans, or some people still like original Medicare. Okay. So over here, Mapa wanted me to talk to you about the Medicare supplemental plans. So there's many different supplemental plans out there. If you look at the supplemental plans, option 1 or the option on the left, basically there's many different options out there. There's A, B, C, D, F, G, K, L, M, N. Okay, there's many different plans out there. There's also a plan J, which was discontinued. Also, I want to also mention about, so there's a new plan that came in as a plan G. So I wanted to touch briefly about the new plan G. So the plan G recently came out in 2019. The one different thing about the plan G is it does not have, it has a deductible. Okay, so the federal government did not want everything to be 100% covered, like the plan F. Plan F is the most comprehensive plan. Okay, plan F is the most comprehensive plan. The only thing is you can only sign up for the plan F if you have Medicare prior to 2019. So if you have Medicare A and B prior to 2019 or 2019, you can be able to sign up with plan F. Okay. If you get Medicare after 2019, so in 2020 you get Medicare, you can no longer sign up with plan F. And there's only plan G or the other plans listed over here. Okay. But plan F is the only one that you can sign up with if you have Medicare in 2019. But if you get Medicare in 2020, you cannot sign up with Medicare Plan F supplemental plan. Okay, but Plan G recently came out. The reason why Plan G came out is because federal government did not want to have 100% coverage for everything. They wanted to have some people think about some medical expenses. So that's the reason why they have Part B deductible of being in the Plan G. So the deductible for Part B for 2019 is $185 for the deductible. So that way you got to pay the first $185. If you get any kind of doctor coverages, Part B, medical services, you got to pay the first $185. Then the plan will kick in at 100% after that under Plan G. So this basically wanted you to think about your services done at least for the first time when you go to the doctor. Okay, so that's what the Plan G. But there's also other plans, but the usually plan people look at is Plan K, Plan N, Plan F, or Plan G. Okay, those are what most of the times most clients gravitate towards. But everyone is different. We can, if you wanted to talk about all the supplemental plans, we can sit down and we can always go over the supplemental plans in detail. Okay, but basically the supplemental plans, many different companies have it, but usually it goes on price. People just go off of the cheapest. They go with the plan and they go with whatever carrier has the cheapest plan for that. Because basically Medicare is primary, whatever the Medicare is not paid, the supplemental plan, if you do pick up a supplemental plan, that carries the difference depending on what plan you go with. Okay. Now there's supplemental plans. Basically, supplemental plans doesn't have a drug plan. So because it doesn't have a drug plan, if you want to go with a supplemental plan, you want to probably look into a drug plan. Okay. One thing I want to note is that 52% qualify for a thing called LIS, low income subsidy. Okay, so if you're looking at a drug plan, a lot of times people may qualify for extra help, or also known as low income subsidy. So if your clients, or if you do fall into this category, where if a single making under $1,798 for singles, or as a couple under $2,433 for a couple, and you have resources as a single under $14,390 for singles, or under $28,720 for couples, you may qualify for a thing called low-income subsidy or extra help. So if your clients or yourself do fall into this category, come and see us, or you can be able to apply on Medicare.gov, or on actually most of Social Security has that thing, or you can come and see us. We have a handout. You can be able to fill that out and send it in. Okay, well, there's also other places that can be able to help assist you with that as well. Okay, but that's a very important is 52% does qualify for a thing called low-income subsidy. So if you qualify for low-income subsidy, that will help with your deductibles. Your co-payments will be reduced a lot, and your premiums could also possibly be reduced as well. Okay. Okay. So now we'll go to the any questions about these kind of things? Now we're actually going to go to Medicare.gov site. So we're going to do this on the fly. Okay. So if you look at Medicare.gov, okay, this is a pretty good site to go with. Okay. So on Medicare.gov,
It's not touchscreen. Oh, sorry. 2 fingers.
okay.
2 fingers.
Okay, so on Medicare.gov, basically the important thing, there's some important things to note, but one thing I wanted to cover is a lot of times people are worried about this 20% procedure things, especially if they have outpatient surgery, same day surgery. A lot of times on Medicare, it's a 20% co-insurance, okay, but 20% of what? Also, if you look at Medicare Advantage plans, a lot of them do have Medicare, do have outpatient surgeries, and they have 20% co-insurance as well. There's some plans that have set co-payments under Medicare Advantage plans, but some plans do not, and then the original Medicare has a percentage. So I wanted to go over some of these buttons over here. So my eyes, one important thing is this need a procedure. You can click on that, and you can look at be able to find out what that price will be, as long as you know what the CPT code is. C is in cat, P is in Peter, T is in Tommy. So if you know the CPT code, then you can be able to figure out what plan, how much the services cost. Okay, so if you do a search on different things, okay, so you can do a search on many different things. So let's see, if you want to have like a cataract surgery or something like that. So if you want to have like a cataract surgery, so you can just type in like the code of that. If the doctor gives you the code for the cataract surgery of whatever the procedure is going to be done, and so maybe he tells you the cataract surgery is going to be 66984, then you can just put that in the box, and then out comes something is going to come out, and you can click on that, and you can find out exactly how much you're going to pay depending where you go. Yeah, so this is a pretty good thing, so that you're not surprised by your co-payments or co-insurances about different surgeries, especially same-day surgeries. But also you can look to see that it's cheaper if you go to an ambulatory surgical center versus if you go to an outpatient hospital facility. So a lot of times if you want to save some costs on things, you go to an ambulatory surgical center. Now the thing is, sometimes it might make a difference. Yeah. Sometimes like if you have some like kind of health issues, you might have to only go to the outpatient hospital facility. Why? Because outpatient hospital facility is located next to an emergency room. So if anything complications happen during that surgery in the hospital facility, you can easily go get sent to the emergency room. Okay. Versus ambulatory surgical center, not located near emergency. So if complications happens, sometimes you might just have to be rushed by ambulance. Okay. So sometimes, so even like when I had a shoulder surgery myself, my doctor, my surgeon actually could have done it in an ambulatory surgical center because I have a history of seizures. He said that better I do it in Queens Hospital. So that's where I did my surgery in an outpatient hospital facility for my shoulder surgery. So everyone is different, but if you want to save cost, ambulatory surgical center is fine, but it also could depend on your health and what kind of surgeries you're doing. Okay, so I just want to give you an idea. That's the place you can be able to go. Okay, you can also search for other procedures as well. So maybe you wanted to do I don't know, maybe like a lumbar surgery. Okay, so there's many different things. Say you don't know exactly what the code is as well. Okay, so you can just do you can kind of figure out by putting in lumbar, your back surgery, you can be able to figure out, kind of figure out what it is if your doctor does not know, but more than likely your doctor will know what code you're using. So if you see, like if you're doing a destruction of a nerve or whatever, you can exactly what the price is going to be. So normally the price of that 20% comes out to around $150 to around $400, but sometimes that 20% could come out to be a lot higher. Yeah. So it could come out to be a lot higher. Say take like an arthroscopic knee surgery or things. Sometimes those ones are a lot higher. Okay, and we could come out that 20% could come out to around $1,000, or maybe I even had one client that 20% came out to around $2,000. Even one actually came out to be $4,000 for a spine surgery. Okay, so it's important to know these kind of things. I don't want you to be surprised by this co-insurance. Okay, so if you don't want that co-insurance, some plans have a co-payment as well. So everyone is different. Just make sure you're looking at different plans, making sure you check your options. But this is kind of outpatient procedure. This part is very, very important in my eyes by just clicking on that box. Okay, so going back to Medicare.gov, the more important thing that's important to note, I'll make this full screen, is finding health and drug plans. Okay, so over here is probably the part that you guys are probably wanting to learn about or help with, is finding 2020 health and drug plans in the area. So you can click on that over there, and then basically for that one, you can create an account if you want to, or sometimes people don't want to create an account because they don't want to know where you've been. You can always click on continue without logging in. Okay, so if you click on continue without logging in, they're going to be able to ask you what kind of plan you want to look at. You can look at a Medicare Advantage plan, you can look at a Part D drug plan, you can look at a Medigap plan. So it all depends on what you want them to look at. Okay, so for here, we're going to say we're going to be looking at we'll do a simple one. We're going to say we're looking at a Medicare Part D drug plan first. Okay. Okay, so you can look at a Medicare Part D drug plan over here. And then you're going to want to put your zip code. Okay, so over here, we're going to put the zip code that my office is in, which is 96814. But basically, every county is different. So if you're in Honolulu County, that's one plan. There's many different plans for Maui County. There's some plans for different plans for Kauai County, as well as Big Island, Hawaii County. So there's different plans on different counties. So just make sure you're checking you're making sure you have the right plan in your area. Okay, and all depends on where you get your taxes filed and where you get your Social Security filed with. It's depending on what county you're going to be in. Because I do have some people, they have 6 months in Hawaii, 6 months maybe another state. It's a matter of where you get your Social Security checks. It's where your county is listed with Medicare. Okay, so when you're going to click continue, and then after that, they're going to ask you how you get help from costs over here. So if you get help with Medicaid, there's different plans with those that have Medicaid, different kind of plans out there. If you have help from Social Security income, if you're under 65, Medicare Savings Program, get extra help from Social Security like LIS, Low Income Subsidy, prescription drug help. You can click I'm not sure if you don't know, or you can check I don't get any help from these programs. So over here, just for this presentation, I'm just going to say I don't get any help from these programs. Okay, but if you do have Medicaid, you can always click on that, or if you get extra help, you can always click on that too. Okay, if you get extra help on Medicaid, you can actually get help paying for the Part D drug plans if you get Medicaid, or extra help from Social Security LIS. Okay, but we're just going to click on I don't get any extra help from these programs. Then they're going to say, tell us your preferences. Okay, do you want to see your drug costs when you compare? And I would say yes, because it's always important to see what your prices on the drugs. Then they're also going to ask you to see how do you normally fill your prescriptions. So you can fill it out. Do you normally go local pharmacy, or do you mail order, or do you both? So I'm going to say we do both, because sometimes you maybe need to go local pharmacy to pick up something real fast, or maybe you mail order, maybe just your generic medications. So we're going to say we do both. Okay. After checking you do both, we're going to check on next. And then you can type in what kind of drugs you take. So there's many different drugs that you can possibly take. I'm just going to put some of the medications that from one of my clients, she has 30 medications she's taking. So we're just going to pick and choose from one of my clients' medications that has 30 of them. She said I can share the whole thing with you guys, but honestly, I'm not going to share the whole list with you guys. That's too much for me to put in. So I'm just going to put certain medications in here. So one of the medications taking is Actonel. So you can add a drug. So you type in that medication, you add a drug. And then you can see Actonel, it has a lower cost called a bisodonate sodium. Okay, so a lot of times people might know it as the brand names, but more than likely they're actually taking the generic medications. Okay, there are sometimes, like one of my clients, they couldn't take the generic, they can only take the brand names. So if they have to take the brand names, then that's fine. Just make sure use the brand instead. Okay, but this woman guaranteed she takes the generic of it, not the brand name for that. But sometimes if you cannot take the generic, you have to take the brand name, and that's fine. You just click on add brand instead. Okay, but this client of mine, she actually took the generic of that. So I'm just gonna say add generic. Okay, so that's one thing that's good, is sometimes you might only know the brand, but you might actually taking the generic. Or if you're taking the brand name, that's fine. Just make sure you select that you have the brand name. Now after that, they're gonna say you gotta select the dosage of the Actonel generic. Okay, so you can select the dosage. They either have the 5 milligram, 30 milligram, 35 milligram, 150 milligrams. So you can be able to select what dosage that you guys take, that she's taking. So she was actually taking the 150 milligram tablet of it. Okay, and then basically another thing you gotta see is how often do you take the medication. So she took the medication once a month, Actonel. So once a month, you put quantity 1 every month. You can say add to my drug list. Okay, you can add on more drugs. I'll add on some other drugs too. We'll add on a few other medications just so we have so we can do this a little bit faster. So another medication she takes in is Dulera. Add the drug. Then Dulera, basically they're asking her what kind of things is it? You have either the 100 5 mcg or the 200. She's taking the 200 by 5. Okay, and that's the same package she's taking, so that's fine. So you gotta add that to the list. Okay, and then maybe we'll add on one more medication. We'll add on an expensive one. We'll add on Prolia, that some of my clients are taking somewhat. Okay, and we're just gonna say for fast sake, we're just gonna say to take 1 dosage or whatever. Okay, so we have 3 medications over here. Just for ease of use, we're just gonna say we're done adding drugs, but you can always keep on adding more medications. For that client, I added on all her 30 medications, compared them all. But so that's for ease of use, we're just gonna say we're done adding medications, 3 medications. So we're gonna say we're done adding medications. Okay, and then because we pick up our medications from local as well as mail order, then they're gonna have us choose this pharmacy closest to the area that we put our zip code on. So then you're gonna say what pharmacy you go to, whether it be Walgreens, Walmart, Sam's Club, Sam's, Walgreens or whatever, Happy Pharmacy. So there's many different ones. We're just gonna say we're going to Walmart. I like times, but I don't see times over here, so we're just gonna go closest. We're gonna say we go to Walmart. Okay, and we're gonna say done. Okay, and so then basically it's gonna come out, show all your 25 prescription drug plans in the Honolulu County, which we said we're located at. Okay, so for that one, basically for this one, the first thing that it's gonna say is it's gonna say short plans by lowest monthly premium. Okay, in my eyes, lowest monthly premium is probably not the best one to go with, especially if you're taking some brand name drugs. But you can see they just have several different plans out there. Yeah, so there's that 1320 Hmo Walmart plan. It's also the Clear Health Spring plan, 1420. It's also the WellCare RX plan, $14.20. So there's many different plans out there, and sometimes it doesn't matter about premiums. Yeah, the lower premium, probably you're gonna pay the higher cost. Okay, so there's also the WellCare Value Script, also the Express Scripts Medicare Saver plan, the Silver Script Choice plan. So there's many different drug plans out there. The Medicare RX Select plan. Okay, so many different plans out there. Cigna Health Spring Plan, 25 different plans. Omaha RX Plan, 2280. There's also the WellCare Medicare RX, 2290. And there's also there's also many other pages showing 10 at a time. You can click on the second page, and they have some other plans out there too. So there's 25 different plans, 10 at a time. Okay, so there's many different plans out there. Okay, so you can be able to choose. But in my eyes, yeah, I wouldn't go by plan premium. I would sort plans by lowest drug and premium cost. You want to add in not only the premiums, but I also want to add in the drug costs as well. Okay, so if you do that, then you're gonna get the lowest premium, the lowest cost according to what drugs you put in there. Okay, so then it's gonna go, to me, the important thing is whether you go retail pharmacy or whether you go mail pharmacy, you're gonna see how much money is you're gonna spend for that year. Okay, so what's good about this is Medicare.gov, you can also compare up to 3 different plans in the area. Okay, so you compare up to 3 plans in the area. So you can compare, like you want to just compare to maybe the top 3. Okay, so say over here, because the medications we put in, according to the medications we put in, it's saying Mutual Omaha is a good one, ARP Medicare RX Preferred is also a good one, or WellCare Medicare RX is a good one. Those are showing us the 3 ones that are good per se. Okay, so you can do a comparison, add to compare, up to 3 different plans. Okay, and you can compare the plans side by side. This is probably more so, we're going to go over the Medicare Advantage plans as well, how you compare that. It's probably a little bit more advantageous on the Medicare Advantage side comparing plans, but you can see on just drug plans, you can compare the drug plans, where they compare premiums side by side. You can see everyone has different deductibles. So the standard deductible is $435. So that means you got to pay the first $435. After that, the plan will kick in. You see the zero premium or zero deductible, but you can see that premium is $72.70. So there's zero deductible, but you're paying a lot higher premiums for that. So everyone is different. You know, just make sure you know what plan you're going to go on depending on your prescriptions. Okay. One thing you look at is more further down. You look at drugs covered or not covered. Look at the Walmart pharmacy, the Mutual Omaha plan has all 3 drugs covered. Okay. The other two plans, the ARP and the WellCare Saver plan, basically it doesn't cover one of the drugs. Okay, restrictions apply. Okay, so you can always click on it over here, restrictions apply. You can see more so how much you're going to pay for the year. Okay, so you can see exactly what the retail cost of the drug is. You're going to see how much the price is going to be after your deductible, how much the cost in the gap will be if you ever hit the gap. So basically, all the drug plans have a thing called have a deductible, or some plans have no deductible if you pay a higher price. Okay, but basically all the plans look at the total cost of the drug, whatever you pay and whatever the insurance carrier pays. That price if that cost ever equals for 2020 ever equals $4,020, that's when you're going to fall into what is called the coverage gap. So again, that's whatever you pay and whatever the insurance carrier pays that ever equals $4,020 for 2020. That's when you're going to fall into what is called the coverage gap. And when you ever hit the coverage gap, then that's when you're going to pay 25% for your generic medications as well as your brand name medications for 2020. Okay. Then the next thing, if you ever hit the coverage gap, how you get out of the coverage gap, is to look at how much money you paid out of your own pocket. If out of your own pocket comes out to be $6,350, that's when you're going to fall into what is called the catastrophic level, at which you're going to see, also known as the coverage gap level, at which you're going to pay a lot more lesser if you see cost after coverage gap. Okay, so that's what those prices and those little boxes are. Deductible, cost while in the gap, that 20%, 25%, the cost after the coverage gap, which would probably be brought down drastically. Okay, federal government does say 20% of the Medicare beneficiaries does hit the coverage gap, 5% will hit the catastrophic level. The reason why it's easier to hit the coverage gap is look at how much the total cost of the drug is, whatever you paid, whatever the insurance carrier paid, that ever equals $4,020. That's when you're going to fall into the coverage gap for 2020. Hit the catastrophic level, you got to look at how much you paid out of your own pocket now. That equals $6,350. That's when you're going to fall into the catastrophic level for 2020. Okay, and over here, and so that's how they come up with the estimated costs. And the good thing with Medicare.gov is they also compare, they go down the list about by month how much you're going to pay. Yeah, so of course, if you're looking at what I'm looking at for this one, January, you're going to pay a higher cost, January, February, March. Okay, after that, you're going to pay a lower cost. Maybe we'll look at the other drug plan where it actually has all the drugs located in there. Go back to comparisons. And we'll look at the plan that has all that drugs in there with the Mutual Omaha RX Plus. It has the three of the three covered. Click over here, restrictions apply. And then you can see all the medications are kind of covered. So when you're looking at estimated monthly costs, it's pretty, you can kind of see it a little bit easier. Basically in January, you're going to pay a little bit more because in January it has a deductible of $435. Then in February, the prices go back down. And then you probably hit the coverage gap in March, and that's why you're paying a little bit higher price in March, April, May, June. Okay, in August you're gonna not hit that coverage gap, or you're gonna be in a catastrophic level. So in August the prices go back down to $79.23. Okay, now this is just a standalone Part D drug plan. Okay, so some of those just on Medicaid, a lot of times if you don't do anything, you're gonna be automatically assigned into a standalone Part D drug plan. Or maybe if you have a Medicare supplemental plan, you have a standalone Part D drug plan as well. Okay, so some people might have that. Now, if you have Medicaid, in my eyes, you probably want to go with a dual special needs plan instead of a Part D drug plan. But sometimes people just rather have a drug plan on Medicaid, which is fine. Everyone is different. Just make sure you have a plan that's good for yourself. Okay, I do sell it sometimes where husband and wife have two different plans with two different companies. Just because everyone is different, some people want different kind of benefits. Okay. Now you can also go into details. So if you want to know about the details about certain plans, you can go into the details about the plans. So all you have to do is click on the details, and you can go more into details about the plan. So they talk about the deductible, the premium, talks about the co-payments about the plans. Okay. Talks about the gap coverage. Talks about how much you would pay if you hit the catastrophic level. So this is pretty good information over here. Okay, and also talks about how much you're paid. Basically, it was the same kind of page that we were in, that we were looking at before. Okay, other pharmacy prices as well. So this Prolia one is a very expensive medication. That's what some people do it. The Prolia medication, sometimes I do have it. It's a Part D or a Part B drug, depending on how the doctor bills it. Sometimes the doctor bills it as a Part B, which would be he's doing in the doctor's office or hospital, or sometimes the doctor will bill it as a Part D as in David, where he's gonna that one you gotta pay a co-payment from the pharmacy. Okay, so it depends on how they bill it. Prolia is actually a Part D or a Part B drug, depending. Okay, we can also go. So we're gonna go back to the results. So another thing you can also compare. So if you want to just compare the drug plans, you can. But what if you wanted to view the Medicare Advantage plans in the area? Okay, so we looked at the drug plans in the area, but you can also look at the Medicare Advantage plans in the area as well. So you can click over here, you can view 14 available Medicare Advantage plans. So you can also click on that. And then you can see all the different Medicare Advantage plans available in the area. Again, this one it goes by lowest monthly premiums. So don't be so concerned about people might want to go with the cheapest premium. So that could be you. Which you can go the lowest monthly premium. There could be 0 premium plans for Medicare Advantage. There's the Humana one. There's also this is also a new thing that came in over here, but people might be concerned about is this MSA Lasso Healthcare. So some people might be looking at that one. Basically, this MSA plan is basically for those that mostly have HSA accounts and rather have the HSA same kind of thing come out, same kind of similar plan. Then you might want to check out that MSA plans. But most times people in Hawaii, we're not used to HSA accounts because we have the prepaid healthcare rule in Hawaii. Because we have the prepaid healthcare rule in Hawaii, most times we don't have HSA accounts at which we have either group medical insurance from the various carriers that do group medical in Hawaii. Okay, so for that, what that says, LASSO is one that some people can look at, but more than likely, when I look at it, it has a high deductible, and it has such a high deductible. A lot of times, since it has so high deductible, people rather look into a Medicare Advantage plan, zero premium one, or even look into a supplemental plan, with maybe a supplemental F plan, high deductible F plan, or a K plan. Okay. Okay. Now there's also the other Medicare Advantage, the ARP, United Healthcare. You have the ARP Zero Premium Essential Plan. The Essential Plan has no drugs on here though. To make sure, some plans have no drugs. So the Essential Plan for the ARP Advantage Plan has no drug. So this plan basically is for those that have maybe secondary coverage and already has a drug plan. Maybe they might want to look into a plan like this. Okay. It's also a HMO Ohana plan. There's also a Humana Choice PPO plan, zero premium. There's also HMSA Central Advantage, zero premium. There's also a Ohana Plus plan. That's a HMO, $16.20 plan. There's also Akamai Advantage Complete. That's a $28 a month plan. There's also Humana Choice PPO, $54 a month. Okay. It's also page 2. It's also the ARP Advantage $55 plan. There's also the Kaiser Advantage Senior $78 plan. It's also HMSA Advantage Akamai Complete Plus $445. So there's many different plans out there. There's also the Kaiser Senior Advantage HMO $176 a month. So everyone is different. Just make sure you have a plan that's good for yourself. Yeah, you want to make sure that you're not going to join. Sometimes I had a meeting where they had one of my clients invited 20 of her friends to her house, okay, and they all signed up with the same plan that she wanted, okay, which was not the best ideals, because all those 20 people, half of them realized that they didn't want to sign up with the plan that she wanted. They wanted to look into a supplemental plan or look into another plan. So that's why just make sure you have a plan that's good for yourself.
So someone has chatted and said, I didn't see a rating for HMSA. Could we go over the ratings for the plans?
Okay. So the ratings really didn't come out for the 2019 plans. We have the ratings for the 2019. The 2020 plans, the star ratings have recently came out. The star ratings for HMSA is over here. 4 stars for HMSA. HMSA has a 4-star rating plan. In my eyes, I've been doing this for a pretty long time. In my eyes, as long as a plan is 3.5 or above, that's good enough, average or above. But you know, if sometimes people want to look at the star ratings, consider that accordingly. The only 5-star rating plan in Hawaii is gonna be Kaiser. So if you like Kaiser, Kaiser is the only one that has a 5-star rated. The other plans have like 4, 4.5. Some has 3 and different things. Okay, but in my eyes, as long as the plan is 3.5 or above, that's good enough. But if you just want to look at star ratings, a lot of plans have 3.5 to 4. If Kaiser has the 5. Okay, but everyone is different. Just make sure you have a plan that's good for yourself. Okay. Now what I'm gonna do is you can also compare plans in the area. So I'm gonna compare plans. Okay. So basically, I'm just gonna compare. To make it easy, I'm just gonna compare HMO plans. Some HMO plans, because there's many different PPO plans in here. I don't want to be biased. I don't want to show that I'm biased towards you guys, or I don't want you to think I'm biased. Yeah, so I'm trying to get this tip box down away, but I cannot get it to go away. So it's just in the area in the way. So we're just gonna compare HMO plans, but you guys always compare PPO. You can compare whatever out there. I just want to show you guys at least a comparison. So I'm kind of non-biased. I'm gonna show this the HMO plans. So we're gonna show a Humana HMO. So with the Humana HMO, we do the HMSA HMO, and we'll do Kaiser HMO. Then you can kind of see different HMO plans. Okay, and we can compare 3 plans at a time. Get rid of this. Okay, so we compare 3 plans at a time. Basically, you can see is going to be the 3 plans. You can see all of them is, so 0 for the Humana, 0 for the HMSA, Kaiser is $78. Okay. So you can see that every plan has different deductibles. Yeah. Some plans have deductibles on the health side. Most of the plans have deductibles on the drug side. Actually, HMSA doesn't have a drug plan deductible. So everyone has different ways of doing their plans. So everyone is different. So just make sure you look at the different plans in the area. You can always check on plan details over here. But in my eyes, I wouldn't really check on plan details. Okay, sorry, I cannot get rid of this orange box, tip box over here. Okay, but we're just gonna look at the plan. So basically we can look at the premiums, and everyone can allocate their premiums differently. Sometimes people allocate their premiums on the health side, sometimes allocate their premiums on the drug side, or a combination of both. Okay. You can also look at the deductible for the drug plans. You can also look at the maximum out-of-pocket limits. And also you can be able to see what plan has different extra benefits out there. Some people want different benefits, like say the transportation, over the counter, and different things like that, telehealth and things. So just make sure you can always look at the benefits on that. Okay. But the more important thing I like to look at is this benefits and cost comparison side, everything, the plan side by side. Okay, so you can compare depending on what benefits you're looking at. Everyone looks at different benefits. Okay, everyone's concerned about different things. Just make sure you can be able to compare all these different benefits side by side. Whether you're looking at diagnostic procedures, you know, you can even go, if you don't know what a diagnostic procedure, you can click on that arrow that says test done to confirm. Okay, so you can also be able to look at different things over here. Okay, so you can see lab services, you can compare all the radiology things, outpatient x-rays, urgent care, hospital coverages, can be able to look at that. Look at to see the outpatient hospital services, that's the same day surgery, in that day, out the same day. Okay, some has a set co-payment, some has 20%. So that's always important to look at, depending on if you're concerned about that. And note that this is a year-to-year contract. So you're not stuck with this plan for the whole year. Yeah, you can it's only year to year. You can also make another change from January 1st to March 31st. So that also means that you can always just try out the plan. If you want to change the plan, you can always change it from January 1st to March 31st. Okay, and whatever plan you change with will be effective the first of the following month. Okay, you can see that some plans have hearing aid coverages, some plans have dental, some has wellness programs if it's covered, some has transportation or not. Yeah. So you can compare side by side all of these benefits. Okay. Only thing is when I'm printing these out, sometimes it doesn't really come out when I print them out. Okay. With my regular printer. But you can see it very good over here. I just don't know why I cannot print it out where I get all of these things together. If I print it out, all I'm going to get is the first page, and that's about it. So that's just a note that I've had when I try to print out this for my clients. I couldn't really print it out per se, all of these benefits side by side. Basically, you can look at it, but when you try to print it out, it's kind of tough it doesn't really come out. That's what from my personal experience. Okay. Now, if you wanted to look at the drugs, you can be able to see, if you want to, these Medicare plans, you can look at the drugs, and basically, again, we can be able to compare the drugs in here by clicking on restrictions apply. So you click on that, basically you get the same thing as it would when we're comparing the drug plans. Basically, it can tell you how much you pay, retail cost of it is, how much you pay before deductible, how much you pay after deductible, how much you would pay if you ever hit the coverage gap, or if you ever hit the catastrophic level. Okay? But the more important thing in my eyes is looking at this estimated monthly costs, because that kind of can tell you exactly how much you're going to pay per month. Okay, again, I put the Prolia medication in there, which is pretty expensive. Most times people don't take that. But yeah, I just wanted to put that in so you can kind of see how they compare. Okay, so you can see per month how much you would pay. Okay, and you can also see how much you would pay if you wanted to mail order. Because sometimes you might want to mail order medications. Sometimes mail ordering is actually more affordable too. A lot of times you're just paying the mainland price, not the Hawaii price. Okay. Anyone have any questions about this? How you can be able to compare plans, go back to the comparisons. You can be able to look at all the comparisons out there. Okay. So that's pretty much how you can compare the plans. You can compare the Medicare Advantage plans. You can always go back to results. Yeah. You can always change locations. You can also change the medications of our medications. We can change our medications. If we wanted to change our medications, we can change our medications. And another thing you can also do is you can also enroll online. Okay, or if you want to know the details of one. Say I wanted to know the details of, we'll say Kaiser. So if you want to know the details of Kaiser, you can always plan details, click on that.
If you guys have any questions, please send it in the chat box. We have about 10 more minutes for Travis. Otherwise, you can reach out to him yourself personally. He will be letting you know his contact information at the end as well.
And they go into very detail on the plan details for the Kaiser plan. So they have a lot of detailed benefits. So if you click on the details, you can be able to see they have many different optional packages as well. Okay, and then you can also look at all the more detailed how much it's going to cost for generic, preferred generic, regular generic, preferred brand, non-preferred, specialties, vaccines. Okay, yeah, there's a lot of important details. You can always go to the plan website afterwards, or you can also has a phone number over there as well. Okay. Also, the Medicare.gov allows you to enroll. Yeah, so if you want to enroll, you can also enroll on Medicare.gov. But in my eyes, I don't think you should really enroll on Medicare.gov. I would think that you would want to enroll with either a broker or someone locally over here. The reason why is because that's just another person that can be able to help you. Now, if you enroll from a person, they're not going to charge you any additional premium. They cannot charge you any additional premium. Everything is all locked in. So whether you go to a person locally over here or a broker, you're going to be paying the same price. So it's always good working with either a broker or a local agent over here. Why? Because they can be able to help assist you locally. Sometimes a broker can also be able to come to your house and explain all the different various plans as well. Okay, so it's always important to work with a local person because it doesn't cost you any more premiums. It's going to cost you the same amount so that you can be able to have assistance from a live person, which is always a good thing. Okay. Also, working a broker. The difference with working a broker versus a captive is that brokers can also have knowledge about the other companies as well. Okay, they also might have some other products, but captive agents are still good too because they should know very much well about their plan. Okay, but just as in my opinion, it'd be good to enroll with a live person, local person, versus enrolling online, because if you enroll online, then your customer service is all online. Okay. Some plans have local customer service as well, so you also might want to look at that. Some plans have mainland customer service, so that's another important thing to possibly look at as well. Okay. But if anyone has any questions, feel free to give me a call. My cell phone is 542-5109, or you can also call my office 792-5197. We do a very good job working with the Generation Magazine, Percy Hara. We also work at a lot of different office buildings and staff as well. Okay, but we have a very good knowledge about many different plans. I've been in this business for 15 years. We just want to make sure loyalty is to you guys, our clients. So we want to make sure you have a good plan for yourself because everyone is different. Okay. Also, service is also important. So even if you get the plan, knowing how to use the plan is also very important. So as an agency for us, we always make sure we contact our clients twice a year, at least from October. For AEP, we also contact and have a thing for our clients in January and beginning of February, OAP, to make sure they know how to use the plan as well. So that's a good thing that we do, but just make sure you're make sure you're working with a live person, local person, because that can be able to help assist you. Okay.
All right. Well, thank you, Travis, for being here today or having me in your office today. Oops, sorry. Just going to readjust the camera a little bit. So I'm Mapuana Ta'amu. And before we go, I wanted to give a little shout out to what's happening next month. C. Hara talking about aging in place, how to fund your retirement. So he is a reverse mortgage specialist, and we would like you folks to join us on November 21st. It should be the Thursday right before Thanksgiving, so that you can enjoy your Thanksgiving meal with your family and friends. But same time, 11:30 till 12:45. Percy Hara will be talking about aging in place, what that means, what it looks like, what is a reverse mortgage, maybe how a reverse mortgage might fit for your situation. What are the benefits, maybe some cons as well, and what are the steps to obtaining a reverse mortgage. I personally have no understanding of reverse mortgages at all, so I'm personally excited to hear what he has to say about the topic. But for today, if you do have any more questions, we have a couple more minutes. Please send in your questions, and thank you for those of you who have been using the chat box or the Q&A box as well. I really appreciate you folks sending in your information or questions and letting us know what you think and things of that sort. So until next month, I guess that's all for today. Travis, you want to say anything else?
No, that's it. Thank you very much. Have a happy Halloween, everyone.
Alrighty.
Be safe out there.
Stay safe. Bye.